Are you still struggling to control your acid reflux? Have you tried all the suggestions on YouTube with only a little relief or no help at all? In this video, I'll reveal 7 natural and surprising ways to control your acid reflux that many experts don't usually talk about. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor and author of the Amazon bestseller Sleep Interrupted. My passion is to help you get the sleep you need for the life you want. If you struggle with acid reflux, then you won't get good sleep and you won't be able to enjoy your life either. Acid reflux is a very common problem that millions of people suffer from, where you feel pain or burning in your upper stomach or lower chest, and it can even come up into your throat, with coughing, throat clearing, hoarseness, and throat pain. And this can happen during the day, but it can also be especially bad at night when you're sleeping. If you feel it in the stomach area, it's called gastroesophageal reflux disease, and if it reaches your throat, it's called laryngopharyngeal reflux disease. Even worse is not only acid that comes up and reaches your throat. You can have a certain stomach enzyme come up and reach your nose, sinuses, ears, and lungs as well. I'll tell you which enzyme this is later in the video. I went through a dozen or so of the most popular YouTube videos on acid reflux, and the most common tips seem to be within these general 7 categories. Number 1, avoid eating late, about 3 to 4 hours before bedtime, which I strongly agree with. You want to go to bed on an empty stomach. Number 2 is changing your sleep position, staying off your back, or using wedges, pillows, or even raising the top of your bed about 2 to 4 inches by placing books or bricks. Number 3, avoid any of the classic foods that cause acid reflux, such as chocolate, soft drinks, peppermint, tomatoes, fried foods, or spicy foods. Number 4, stop smoking and cut down or cut out alcohol, especially before bedtime. Number 5, lose weight, don't overeat, and don't wear tight clothing. Number 6, take apple cider vinegar. The argument is that most of you with acid reflux have too little acid in your stomach. Actually, it's not that you have too little acid, but that it's not acid enough. Number 7, try supplements such as melatonin, DGL licorice, baking soda, honey, ginger, or turmeric. All these options may work to various degrees, but all they do is cover up your symptoms and not get to the root of the problem. If you go to your doctor, they'll usually recommend the first 5 of the just mentioned tips only, and then we'll go ahead and recommend over-the-counter or prescription medications such as H2 blockers or proton pump inhibitors. You may know the brand names Tagamet, Zantac, Prilosec, and Prevacid. Actually, Zantac was taken off the market in 2020 due to an ingredient that causes cancer. These medications block acid production in your stomach in 2 different ways to lower acid production. Tagamet or Pepcid blocks the H2 receptor in the stomach, and Prilosec and Prevacid block the proton pump. And in this 2009 study, the proton pump inhibitors were linked to higher rates of pneumonia in hospitalized patients by 30% compared to controls. They estimated that about 50% of hospitalized patients get these medications, and that around 180,000 patients get pneumonia, and 33,000 will die as a result of being given these medications. It's likely because lowering the acid in the stomach won't kill all the bacteria when it comes up into the throat, and it also gets aspirated into the lungs. Proton pump inhibitors also have been shown to cause higher rates of osteoporosis and bone fractures, dementia, kidney damage, C. difficile infections, cancer, heart attack, and stroke. So now that I've convinced you to avoid all medications for reflux, what can you do or take if you've already tried the various natural options on the internet with no success so far? As I've mentioned in previous videos and in my book Sleep Interrupted, acid reflux is not a problem with making too much acid or acid coming up into the lower esophagus or the throat. You're supposed to make very acidic juices in your stomach to break down and digest food properly. So let me go over the 7 general topics or principles that are important to address if you want to control acid reflux for good. Instead of covering up the burning and discomfort, these are ways to address what's causing it, and as a result, many other aspects of your health will improve as well, including your digestion, sleep quality, weight issues, anxiety, depression, lack of energy, and even your skin. The first thing I want to start with is stress. I know that everyone talks about stress and you're probably sick of hearing about it. There's a common quote that about 90% of all diseases is caused or aggravated by stress. That may seem like an outrageous statement, but I do believe that there's some truth to it. One of the eureka moments I had before I wrote my book Sleep Interrupted was after reading Dr. Robert Sapolsky's book Why Zebras Don't Get Ulcers. He tells a humorous account of Dr. Hans Selye, who's given credit for describing how mammals respond to stress with a fight or flight response. Stress is not only your body's physical response to danger, but also to emotional, psychological, and physiologic stress. The basic premise of my book is that all modern humans are susceptible to stress because modern human airways are now smaller, and it's more difficult to breathe properly at night, and this leads to inefficient sleep. This is the most important principle. If you're running from a tiger, the last thing your body needs or wants to do is to stop and digest food, admire a beautiful landscape, or reproduce. It has to mobilize your heart, brain, and core muscles to run away or stay and fight. Physiologically, your body diverts all blood flow and energy away from your gut and the skin to your core central muscles. This is why you're not going to be hungry sitting in front of a dinner table if you're angry or sad. Your stomach shuts down and acid secretion will stop as well. Yes, a lot of people do have physical dangers, but in our modern society, the vast majority of stress comes from non-physical, psychological, or emotional reasons. So all the different sources of stress combine to show up as a disease condition. And in your case, it's acid reflux. This is why it's so important to build into your daily schedule regular breaks where you can relax and take a breather. Learn some simple breathing exercises such as the relaxing breath or meditation exercises, which I'll link to below. Interestingly, I found one YouTube video where the practitioner demonstrated a breathing technique to improve acid reflux. I'll put the link below. I'm not sure how these exercises help to tighten your lower esophageal sphincter, but the deep breathing techniques can relax and calm your body. There are also countless examples like this, but one memorable book that I read during medical school was Dr. Bernie Siegel's Love, Medicine, and Miracles. Dr. Siegel was a Yale cancer surgeon who studied women with advanced breast cancer. He found consistently that women who drew pictures with dark colors or themes before treatment were more likely to have a poor prognosis. Emotional and psychological stress, unresolved conflict, and emotional and physical trauma will shut down not only the higher centers of your brain, but also your digestive and reproductive organs, depriving them of blood. If you have less blood flow to an organ, the first thing that happens is that it doesn't work as well, and later, chronic lack of oxygen will predispose you to cancer. Notice that the top cancers for men and women, besides lung cancer from smoking, are all either reproductive or digestive organs. Breast, colon, and uterus for women, and prostate, colorectal, and bladder for men. If you're overly anxious in general, or have too many unhealthy, pessimistic thoughts, then find some professional help. There are also a lot of helpful online resources, such as through a life coach, before you think about formal counseling, especially if you feel stuck in life. Number 2, you're making too little acid. I alluded to this in item number 1. In addition to stress, there are a number of other reasons why you may not be making enough acid in your stomach, and what can happen as a result. Besides acid-reducing medications, older age, vitamin deficiencies such as zinc or vitamin B, and a variety of other commonly prescribed medications can also lower acid production. Other factors that can lower stomach acid include gluten, sugar, and omega-6 oils. It's also been shown that you need strong acid levels for the lower esophageal sphincter to tighten, as well as to fully activate various digestive enzymes, including pepsin. Lastly, if there isn't enough acid to kill the stomach bacteria, then it'll pass into the small intestine with possible small intestinal bacteria overgrowth, or SIBO. Now here's one interesting finding related to acid reflux and stress levels. This study had 42 subjects who had pH probes inserted into the lower esophagus and were placed in validated stressful situations. Saliva was also taken to measure cortisol at multiple points throughout the test. What they found was that there was no lowered pH levels in the group that underwent the stressful situation, but experienced subjective reflux compared with the control group. This was despite the higher salivary cortisol levels measured. What the authors suggested was that during the periods of stress, you'll have lower thresholds for pain or discomfort, or even activate a memory of a past painful event under stressful conditions. Almost like a gastric post-traumatic stress disorder or PTSD event. However, this study didn't show that there was no reflux. All they measured were pH levels, so you can still have non-acid reflux. It's more likely that it's the enzyme pepsin that's causing pain and irritation in the esophagus or the throat. Number 3, this one may sound like it's out of left field, but how can a stuffy nose cause acid reflux? Another one of the revelations that I talk about in my book Sleep Interrupted is that I found some studies showing that treating obstructive sleep apnea helps reflux, and treating reflux helps to improve sleep apnea. But how can this be? One basic principle is that the more congested your nose is, or if you have anything else that narrows the nose or throat, such as large tonsils, you'll snore and stop breathing. Every time you stop breathing, you'll forcefully vacuum up your normal stomach juices into your throat. And stomach juice has been found to reach the nose, sinuses, middle ear, and even down into the lungs. What they also found in the ears, sinuses, and lungs was the stomach enzyme pepsin. So this explains how nasal congestion can aggravate apneas and reflux, But what about what happens in the other direction? How does treating acid reflux help sinusitis? Well, we know that stomach juice is very irritating. If it reaches the nose, it will cause inflammation and swelling, which leads to congestion. If you lower acid stomach production with medications, then what comes out won't be as irritating. In general, patients with reflux are also told to stop eating late, incline to bed, stop eating spicy foods, and various other lifestyle changes. These changes may sometimes help your reflux more than the medication. So an important thing to consider is if your nose is stuffy, do everything possible to clear it so that you can breathe through your nose comfortably with your mouth closed, especially at night. Something many people don't know is that the more you open your mouth, the more your tongue will fall back and cause more obstructed breathing. This is why oftentimes, when you treat sleep apnea thoroughly, your stuffy nose tends to get better. I'm willing to bet that the vast majority of you watching this video who suffer from acid reflux also have a stuffy nose. Do you have acid reflux or stuffy nose, or both? Please place your answer in the comments area below. I'd really like to know. Number 4 is the next step up from number 3, which is to take care of any breathing problems during the day and especially at night. It's been estimated that about 80% of people with sleep apnea in the United States don't know that they have it. As I mentioned above, if you stop breathing at night, you'll have reflux. Another interesting finding is that when you stop breathing, the negative vacuum forces will pull on what's called the phrenoesophageal ligament, which loosens the lower esophageal sphincter. In severe cases, the highest part of the upper stomach can slide into the chest cavity, which is called a hiatal hernia. If these processes go on for many years, you have a higher chance of developing Barrett's esophagitis, which is a precancerous condition of the lower esophagus. There are also strong associations between sleep apnea severity and low thyroid levels. The question here is what causes what? Interestingly, there's a study looking at non-thyroidal illness syndrome in people with moderate to severe sleep apnea. And what they found was that CPAP use raised the low T3 levels to normal in all the patients. And in the same study, patients with subclinical low thyroid levels were placed on CPAP and their high TSH levels normalized in 75%. And you don't have to be an overweight middle-aged man to have sleep apnea. I've known lots of young and thin women with severe obstructive sleep apnea. And you can also have upper airway resistance syndrome, where you stop breathing a lot but don't officially have sleep apnea. I'll place a link to UARS below. Number 5 is vitamin D. You may think that this is crazy, but since vitamin D is a hormone, it's involved with every part of the human body. And this includes the stomach. And we know that in the United States, about 1/3 of adults are vitamin D deficient and 6% are severely deficient. The elderly, obese, and people with more severe sleep apnea have much higher levels of vitamin D deficiency. There aren't any major direct prospective studies on the link between vitamin D and acid reflux, but we know that having low vitamin D makes it harder to treat H. pylori infections in the stomach, as well as to lower gastrin secretion, which is a hormone that stimulates gastric acid when there's food in the stomach. Low vitamin D has also been shown to alter the gut biome and may even prevent stomach cancer. You also need good levels of vitamin D to use calcium for stomach muscle contractions. Number 6 is eating a low carbohydrate diet. This short study found that in obese subjects with reflux, eating a very low carbohydrate diet significantly lowered reflux symptom scores, as well as to lose about 4 pounds on average in the 4 to 5 day study period. Number 7. The last item on this list is melatonin. I mentioned melatonin briefly earlier as a commonly recommended supplement. I bring it up again as it's a much more important hormone than just a sleep hormone. First of all, melatonin tightens the lower esophageal sphincter, which closes off the stomach juices from entering the lower esophagus. It also lowers insulin and lowers gastric secretions. Additionally, it's been shown that it's made in all of the body's mitochondria, the main energy source inside all your cells. Melatonin has been found to have powerful antioxidant and anti-aging properties. I did a video on the non-sleep health benefits of melatonin, which I'll link to below. The best way to maximize melatonin before you start taking supplements is to avoid any screens within 2 to 4 hours of bedtime, since all these screens have blue light, which lowers melatonin. And get a lot more sun exposure for the benefits of UVB for vitamin D benefits. Also, early morning and late afternoon exposures are important for the near-infrared frequencies that make melatonin throughout your body. So to summarize, number 1, do whatever you can to lower your stress levels. Number 2, avoid anything that can lower acid production such as stress or medications. Number 3, optimize nasal breathing. Number 4, take care of any snoring or sleep apnea, as well as to lose weight if you're overweight. Number 5, get your vitamin D level to above 60. Get more sunlight and or supplement if needed. Number 6, go on a very low carbohydrate diet. This will help you to lose weight as well as many other health benefits. Number 7, promote your body's melatonin production by avoiding screens before bedtime and getting as much sun exposure as possible for vitamin D and the mitochondrial melatonin production. If you found this information helpful, you may also want to find out why you're always tired. Click on the link above to watch my video, Why You're Always Tired, What the Experts Won't Tell You.